Thank you everyone for being with us today. My name is Caitlin. I'm co-director of NCCRT, and welcome to our 2022 virtual kickoff for the Community Health Center Strategic Priority Team. This call is really to lay the groundwork for our in-person session that we'll be hosting next Wednesday at the NCCRT Annual Meeting. We're going to use our time together to really review the purpose of this work, the history of the Community Health Center team, and then get ready for next week. So we hope that this meeting and really this community can be a place where you can learn, have the opportunity to ask questions of our chairs and of your peers as we work to tackle these issues to help us achieve our goal of ultimately 80% every community. So before we dive in, I just want to do some quick housekeeping. I'd like to remind you all that this call is being recorded. We're going to post it on our website, so for folks who are unable to join us today, they can listen in. We'd like this call to be as interactive as possible. So I'm going to ask you right now to mute yourselves. I encourage you to come off of mute, come on camera when asking a question or engaging with our speakers today. We also have a chat feature. So if you're unable to come off of mute or you want to make a comment while someone else is speaking, please feel free to put any comments in the chat box. Yvonne and myself will be monitoring that. So Yvonne, you can go to the next slide. You can go back a slide. There we go. Okay, so we have enough people on the call. I think it might be nice to kind of introduce ourselves and get to meet everybody. So I think we just kind of do a quick round robin. So we'd love to hear your name, where you're from, which organization you represent, and then what's your favorite fall beverage. So again, Caitlin Sylvester, NCCRT. I'm out of New Orleans, Louisiana. And my favorite fall beverage is really my all year round beverage is a lot of hot coffee. So I will pass to Yvonne.
Hi, good afternoon, everyone. My name is Yvonne Lopez. I am the program manager for NCCRT. Really happy to have you all here. And my favorite fall beverage would have to be a nice hot apple cider.
Great. We'll then go to Emily and then Dr. Coronado and then Dr. Hotz.
Hi, everyone. Thank you so much for joining. I'm really excited to see many of you next week. I am based out of Salem, Massachusetts. I'm co-director alongside Caitlin of the NCCRT. And favorite fall beverage, I'm going to have to go with coffee too, but I'm going to add coffee that somebody made for me because that's always a delight.
That sounds wonderful. Hi, everyone. My name is Gloria Coronado, and I am from Kaiser Center for Health Research in Portland, Oregon. So we definitely need lots of warm drinks in the fall. But one of my favorite fall drinks is London Fog, which is like hot Earl Grey tea with honey and milk.
That sounds lovely.
I think, Jim, you're up next.
Jim Hotz, Clinical Service Director, Albany Area Primary Healthcare, Albany, Georgia, which, by the way, is where Miller Brewery makes its Miller Highlight Beer, which is my favorite fall drink, celebrating a University of Georgia win. And next to my homegirl from Albany, Georgia, Dion.
Oh my gosh, Jim, that makes me so warm and fuzzy, the fact that I know all of this and celebrate with you. Hi, everyone. I am Dion Christopher. I'm was raised in Albany, Georgia. I am currently in the Atlanta area of Georgia, and I represent the Colorectal Cancer Alliance. In my fall drink, I do like Miller, but I'm going to go with hot chocolate, especially if it's a cold winter morning or night. But you never know, it might have a splash of something else in it that's not necessarily non-alcoholic.
Wonderful. Next, we'll go to Margaret and then Amanda.
My name is Margaret Hitchcock. I'm Vice President of the California Colorectal Cancer Coalition, and I'm in Davis, California, and we're in beautiful fall weather. And okay, I'm breaking from all of you people. Apparently my gin and tonic after 2 really brutal weeks last week of way too many obligations, got a lot of feedback on Twitter. So I had lime, which apparently is not what British people put in their gin and tonics, and also pomegranates off of my tree. So there you go.
Wow. All right, Amanda and then Kathleen.
Yeah, hello, I'm Amanda Sweeney. I'm a Strategic Partnerships Manager for Cancer Support with the American Cancer Society here in Phoenix, Arizona. And so my favorite beverage has got to be along with a hot coffee. In Arizona, it's definitely too hot to enjoy a hot beverage during the summertime. So it's finally cooling down. So any hot beverage is definitely welcome.
Great. And Kathleen, and then we'll go Jenna and then Jessica.
Good morning, everybody from the West Coast, or good afternoon, I think, on the East Coast, if you're there. I am Kathleen Zoller. I'm a strategic partnership manager for the American Cancer Society. I live in Northern California, so about an hour north of Sacramento in a little town called Yuba City. And my favorite fall beverage, well, I don't know. I was thinking hot chocolate, kind of going along with Dion right now, maybe a little peppermint schnapps in it, or maybe a Kahlua, Bailey's, and coffee. I don't know. Something like that sounds really good right now.
Great, thank you. We'll go Jenna, Jessica, and then Megan.
Hi, I'm Gina Jones from Iowa. I am the program or screening promotion coordinator with our CRC grant. And I guess I should say with the Iowa Department of Health and Human Services, we recently transitioned from the Iowa Department of Public Health. And my favorite fall beverage would be, I love coffee with anything pumpkin spice in it. Kind of boring, but I do love that. So.
Thank you.
Right. Oh, I'll go ahead and jump in. Hey, hello everyone, and it's so great to see so many great faces. Sorry, my camera's not working. I just came from a team, so my platform doesn't transition well. Jessica Jameson, coming to you from Exact Sciences. I'm located in the Bay Area in California. And favorite fall beverage, I'd have to go probably similar to Kathleen, hot chocolate with either peppermint, a few shots of peppermint or peppermint schnapps or something like that.
Sounds lovely. Megan, Stacy, and then Zaramar.
Hello, everyone. Megan Whitted. I am a Cancer Support Strategic Partnerships Manager with the American Cancer Society. And I'm in Minnesota, so I'm all about those hot beverages. I think I have been since September 1st, probably. And it's actually hard to pick just one, but I would say definitely just following suit with the pumpkin spice. So I am a big fan of dark chocolate mochas and with a little bit of pumpkin spice in there. And then I'm also a big fan of those eggnog lattes as well. So anyway, it's hard to pick one usually, but anything warm is always welcome.
Great, thanks, Megan.
Okay, Stacy here. Stacy Miller from the Dallas-Fort Worth area. I'm actually based in Fort Worth with UT Southwestern Moncrief Cancer Institute. I am managing their colorectal cancer screening program, which is a CPRIT funded grant for rural and urban populations here in North Texas. And I'm going to break from the mold with the fall beverage and say, wine all day, any day, at any time. I am here for it.
I love it.
Hi, everyone. I'm Zaramar Soto. I go by Z. My camera does work, but I did hot yoga this morning and I'm sweaty and disgusting. So I will save you from having to look at me. I am located in Denver, Colorado. I'm the cancer system specialist at Colorado Public Health and I don't even know the department name. What am I saying? Colorado's Public Health Department. I primarily handle their CRCCP and MBCCE-PD grants. And my favorite fall beverage is definitely a spiked chai latte.
Wonderful. Well, thank you guys so much. I think I got everyone. So lovely to meet you all. So Vaughn, we can go to the next slide. And now I'm very excited. You already met them, but I'm excited to now pass it on to our two chairs of the Community Health Center group. We have Dr. Jim Hotz and Dr. Gloria Coronado. Dr. Hotz?
Okay, next slide, please. Okay, today's objective. I'm going to give a little bit of history, what we've been doing. This group actually started June 13, 2012. There was a Community Health Center Summit of the National Association of Community Health Centers, NCCRT, where we realize that community health centers is a great equity partner, which is a big thing what we're trying to do. So the community health center strategic planning team, we're going to go over some of our top takeaways from 21, highlights 22, answer questions, then brainstorm to come up with ideas. Next slide. So we start out, 80% in every community is our initiative. It goes on the heels of the 80 by 18 campaign, where we bumped up rates over 7% in less than 5 years. Health centers had a similar bump, and it reemphasized the importance of people working together. Three strategic areas of focus: access and building capacity in communities, catalyzing health systems, mobilizing the public touch points, and break down policy barriers. Next slide, please. So this is how it all comes together. Here's our key focus areas: access and building capacity, touch points. And you can see where community health centers fit into the catalyzing health systems, but they also obviously have to touch policy, health system providers, family history. So that's how it all fits together. If you'd like more information, I'd encourage you to go to 80% in every community strategic plan on the NCCR website. The website's fantastic. Use it and teach others to use it. Next slide. So we're now a little bit of history. Our job is to promote emerging topics and areas of interest. Kind of like Wayne Gretzky, we want to skate to where the puck is going to be, not where it has been. And that was my phone. Yes, I do have a dog bark. And we're looking for new ideas, where we're going to need to go, identify topics for the Blue Star conversations. Members participate in advisory committee for projects pulled from the interest areas. So where we go comes from these interest groups. And of course, we want to make certain that we disseminate the wonderful materials and resources already out there, and identify opportunities to promote the National Colorectal Roundtable. Not everybody knows about the Roundtable, and it's a very important thing to work on. So next slide. So in 2021, we actually had a virtual meeting. What we learned from that, we have tools that are out there to support our partners as they try to overcome the decreased UDS rates. We went back 5 years in our 20 UDS numbers, just from the challenges of COVID. And we realize this is a team game. We have to get partners into this to help us. We want to accelerate our gains. The last year we only went up 2%. So is it going to take us 5 years to get back to the 5 years we lost? We need to get more community health center involvement, and everybody wants a piece of their action. And we want to make certain we join the return to screening movement. Next slide. This is one of our big activities. So, in the past, the National Roundtable has been very responsive to this group. We did an ECW how to use it manual, a next gen manual, colonoscopy calculator, a links to care group. We did an initial steps guide. So this is all stuff that we've done directly out of response to what people from the field say we need to do to get those numbers up. In 2022, we came up with this manual. I worked on this with a number of other folks. It is a fantastic tool, developed off the first steps manual, which is for health centers. But what we realized, you got to do the same damn thing in any primary care practice. So this is not just health centers. This is for everyone. It's a wonderful manual, but it doesn't do any good sitting on a shelf. So we got to get people to understand that and know how to use it. So these are kind of where we've been. It's a wonderful story. What is impressing me from the field is how well this roundtable concept works, how important it is for people to participate. And also what's so frustrating is how long it takes to get highly effective technologies out into communities. And remember, health disparities exist when highly effective technology like colon cancer screening that can reduce death rates by 75% don't go out to every community. So once again, thank you very much. And I'm going to turn it over to Dr. Coronado.
Thank you, Dr. Hotz. Yeah, please advance the slide. So like Dr. Hotz said, I think it's really important to recognize the value of community health centers and just the number of people they serve, the fact that Medicaid enrollment went up during COVID-19 and there are many, many Medicaid enrollees that are served in community health centers. So this work is really important and you know, the fact that NCCRT is creating resources that can be used. I think one of our overarching questions is always how can we get more community health centers to access and use the resources that are available and how can we get this work out into the communities. So that has been kind of a longstanding, I would say, overarching goal of this group. But in addition to the work that Dr. Hotz talked about in terms of updating the STEPS guide, in 2022, there was also a primary care strategy team meeting that occurred in DC. And so it brought together partners as well as experts in primary care to better understand the needs, wants, and challenges faced in primary care settings, and to identify future collaborative opportunities among NCCRT members and primary care organizations and societies. The other goal was to develop strategies to better support primary care clinicians through dissemination of resources, information sharing, and integration of key leaders into NCCRT's strategic priority teams. So I want to pause here just a minute just to kind of ask a couple of questions. Because we do have a little bit of time in this meeting. So the questions I have is what can this group do to capitalize on the outcomes of this meeting? And so how can we as a strategic priority team kind of capitalize on kind of the opportunities to kind of collaborate with primary care organizations and societies so that we can kind of create better partnerships to make sure that best practices are getting out into primary care settings as a whole. And then can we use the identified barriers and partner collaborations to build supporting documents? And so, you know, oftentimes there's a lot of interest in kind of building documents that primary care clinicians can use. And so are there additional or supporting documents, perhaps supporting documents to the STEPS guide that could be helpful in increasing its use among primary care clinicians? So let me just pause there and see if anybody has any comments. And Jim, feel free to chime in about the primary care meeting if you have any other reflections. There is a report of that meeting on the website at NCCRT if you want to read the report before our meeting next week.
This is more, sorry, I'm going to jump in because I always jump in.
Perfect.
So we/C4 in conjunction with the California Dialogue on Cancer, which is our California cancer control efforts, and ACS are putting on a CME and on February 1st. And so we kind of always default to, you know, what's another, so the target audience for this CME is basically CHC/FQHCs. And so I've recruited Emily and or her surrogate or anybody to have you know, we have a variety of things that we're talking about. And a lot of it has to do with the national and state level policy changes impacting the ability to screen or reporting of screening. But the ending of this is going to be, you know, here's some resources to help you as your healthcare systems do better. And we're here to help kind of message at the end.
That's fantastic. So offering CME courses focused on policy changes, because there's been a lot of policy changes. You know, the most recent one is coverage for the follow-up colonoscopy with no copays among Medicare enrollees. So that was really exciting to hear about. And Jim, I know that you have had a longstanding ECHO series that you've run out of Georgia, and I wonder if you want to say a few things about that and how that there might be some next steps that you're thinking about for that.
We've developed an ECHO series out of our CDC project, And we've kind of got an all-star cast, it's kind of the best hits of the National Roundtable. Dr. Coronado actually was our first speaker on this, and, it's been all the top names. And what we found out is, even though it was mainly designed for the Georgia programs, we didn't exclude anybody, and we've had Alaska participation, 60 to 90 people participating on this. And I think it's a tool, how can we best use it? We've talked about a colorectal echo ever since ECHO stands for Enhanced Community Health Outcomes. It's been over 10 years. I just saw the chat from Margaret. So we think it's a template, and it's going to actually be part of our, there's going to be a presentation at the National Roundtable. So I think that, we've learned a lot from, kind of best practices and what actually works, and how to break down barriers with that. So that is, I think, one of the topics of maybe how do we go forward, with this type of echo and spread those.
And Stacy, I know you're doing some great work in Dallas, or in the greater Dallas area. Anything that would be helpful to your group in terms of resources, or is there anything in particular that you might already be using?
I was thinking about, someone mentioned about media, some print things, and that would be, I think, for our population and our community health centers, FQHCs, would be beneficial. But also we're finding that anything that can be like laminated, quick, like reminders that you could post inside of clinic rooms and things like that, to remind, like as frequent reminders as clinic staff are walking in and out of those rooms, just somewhere around that's noticeable, quick to the point. Those seem to be helpful in some of our other screening programs we've utilized.
So laminated materials for exam rooms. Yeah, that's great ideas. Anybody else? Let's go to the next slide. Yeah, please.
I was just going to say, one of the FQHCs that I'm working with on a colorectal cancer screening project is Native Health here in Arizona. So they serve the majority of their patients are Native American. And so we've had some conversations about, culturally appropriate materials and things for them. And it's been eye-opening for me. This is the first time I've done a project focusing on that population and kind of what their perspectives are when it comes to colorectal cancer and how they view cancer. One thing that stood out to me, one of their staff mentioned that, patients and the population that they were reaching out to, the first time they reached out to them, their messaging, talked about, preventing cancer through screening, and they were offering free fit kits. And I guess they had learned that one of the things that culture believes is, actually seeing the word cancer in the advertisement, that's kind of putting it out into the universe. And so they didn't get really anyone who responded to their messaging for these free fit kits. So they changed their messaging. They removed the word cancer and just focused on health and wellness and that piece. And they got a huge response. So it's even just taking that word out of the messaging, because it was something that culturally was not accepted, changed their response tremendously. So it's a big learning curve for me working with this population and kind of what that looks like. But I haven't seen a ton of, materials available focusing on that population, especially with taking into consideration those cultural aspects. So that's definitely something that I'm looking forward to learning more about, and hopefully having access to more resources around that.
That's wonderful. I want to say we need to keep in touch, because my team is doing some work sponsored by CDC that will be developing messages for American Indian populations. And so we're really excited, but we definitely need to keep in touch. We just got the project started and it's a year long. So we'll have a lot more information next year. Maybe for NCCRT, we can have a little panel or something to talk about it. But your comment really also reminds me of a lot of the work I've done in Latino communities, because we hired a lot of interviewers to go door to door, and they were working for the Fred Hutchinson Cancer Research Center. And they came back to us and said, can we take cancer out of the title of the Fred Hutchinson? Because people shut their door on our face and they don't want us talking about cancer. And so we said, sure. And then it turns out, 15 years later, the Fred Hutch actually did officially change its name to the Fred Hutch Cancer Center. No, wait. Yeah, no, they kept cancer in there, but they took out research. Sorry. Yeah, they took out research, unfortunately.
Okay, Margaret, I see Margaret, hand up there.
I do. So I just wanted to, probably specifically for Gloria info. So Selena Donahue, who's on our C4 board, who also, you're shaking your head, so you are aware of her. And we also have her on the agenda for WC4. She also she just started, she used to be ACS and now is working for HealthNet and working on a lot of their colorectal cancer screening initiatives, but has a lot of extension into a lot of the different tribal nations in California. And at our last board meeting, she's also working with someone up in Alaska at the Public Health Department. And so if you want, don't be, she is not shy about saying yes. So she probably mirrors me too much, but but I would say she's a great resource and immensely upbeat and positive. So
and
great. Thank you.
Close to the hour here, and I will just, having presented to the the CDC's colon cancer control program, and they had their meeting last week. Issues that came up was 45. We've now expanded our group by 20%. That's coming screaming back to us from health centers. Colonoscopy completion, less than 50% nationally. A big center in California was under 25% after positive fit. And also the thing that comes out is navigation works. How do we do it if we get open doors? So these are projects that have, as they work with community health centers, come screaming out of the field. I suspect we'll have to be dealing with them at this meeting as well.
Yes, and a great reminder, Dr. Hotz, that this is actually a half-hour meeting. I thought it was a full hour. So let's go to the next slide. And I just want to remind everybody that the annual NCCRT meeting is next week, November 16th through 18th in Baltimore, Maryland at the Sheraton Inner Harbor Hotel. If you haven't already registered, there's a link to the registration here. And there'll be a Community Health Center Strategic Priority Team meeting on Wednesday, November 16th at 3:30 to 5 o'clock in the Loke Raven 1 room. So we look forward to seeing you and others there. Go to the next slide. So the 3 priority areas for 2022 and 2023 are to mobilize national and community level efforts that will lead to health equity and colorectal cancer screening, to support on-time screening as soon as eligible and continue participation per screening recommendations, and then promote timely colonoscopy follow-up to abnormal test results. And so these are kind of the 3 main priorities that we'll be discussing at that meeting. Next slide. And then the objectives of our in-person meeting are to engage members of the Community Health Center Strategic Priority Team, to deliver a short recap of this call, to give feedback in terms of what you guys saw as some important kind of next steps for this committee, review the team charge and the strategic priority team themes, and then strategize how to effectively incorporate NCCRT's 3 priority areas into this work, and then begin to develop project ideas. Next slide. And that's it. I'll hand it back to you, Caitlin.
Yeah, and thank you so much. And this was a wonderful conversation. I was jotting down notes. Again, this call has also been recorded, so we'll be reviewing everything we talked about today and really folding it into our conversation next week. I know we're over time, but if anybody has any additional questions, I encourage you to ask them now. And then other than that, we're really looking forward to seeing everyone next week in person.